Hi guys, it's Rashmina and welcome back to the Peppy podcast. Welcome, welcome. Today we have with us a special guest and her name is Karese Laguerre. She's a registered myofunctional therapist and also the author of a book called Accomplished, which she will tell us a little more about shortly. Hi Karese.
Hi, I'm so excited to be here. Thank you for having me.
Thank you so much for coming.
Thank you.
So tell us about your book and tell us about what you do.
Okay, so I am a myofunctional therapist, which I'm sure might be the first time anybody's ever heard that. A myofunctional therapist is kind of like having a personal trainer for all of the muscles that nobody ever thinks about. So, below your eyes to right above your shoulders. Essentially, what I do is I help to strengthen and coordinate those muscles so that we can help people breathe better, sleep better, just be better. And my book, Accomplished How to Sleep Better, Eliminate Burnout, and Execute Goals, explains that really, really well. It was a passion project of mine where I really felt like there's so much information that we have access to. Humanity has had no greater access than they do today to information. It's abundant. And anytime you go to look for something about sleep, somebody's trying to sell you something or trying to tell you that you have to change this, that, or the other. And it always involves some product, right? Like turn off your television or put your phone away or stop being around blue light or you need this special mattress. But actually, if we were to really stop and think about the physiology behind sleep, like you can make all the changes that the internet will tell you to do, but if you never address something as small and foundational as how you breathe, you're never going to get the real improvements that you want. And without that, you won't be able to be as productive as you want to be. You won't be able to live a life as full as you want to be. And so I wrote Accomplished to really help people hone in on like how you can improve your sleep naturally by just resolving how you breathe, being more conscious about it and making sure that you're breathing the right way because not a lot of people know that there's wrong ways.
I have questions, lots of questions, but
Yeah.
first I want to know how did you suddenly get interested in this field which is quite niche and not that well known?
Oh, yeah. It's super niche. There's probably like less than 500 of us that really practice. Myofunctional therapy kind of fell into my lap almost. It was something that I didn't know about until a pediatric dentist that I was working with had really brought it to my attention. Now, I have four children, and I like to say, as a parent, we always get the highlight reels. And so my children had a lot of things going on, but that I was never talking about because I assumed that it was all just super common. And when I brought some of this stuff up to the pediatric dentist, like how my son was exhibiting a lot of behaviors of ADHD, and my daughter had like every sleep issue under the sun. She was bedwetting every single night. She had night terror. She was sleepwalking. She would toss and turn and all sorts of things. And my younger ones had a lot of upper respiratory issues. Traditional medicine kind of told me, yeah, they'll grow out of it. That's super common. Or for like, the upper respiratory issues, we had a lot of antibiotics. We were on antibiotics all the time. But the pediatric dentist told me to kind of pay attention to how they were breathing, how they were using some of their facial muscles, pay attention to what their face looked like and how everything was developing. And it just was such a mind shift and such a change in perspective as a parent, but also as a clinician. And it was just something that I knew I had to dive deep into. And once I started seeing the changes, because I dove into it very selfishly to help my own children, but I started to see the changes, I was like, oh my gosh, there's so many people who need this. And I feel like I really and truly met my children at the other side of this once they no longer were burdened by all of this stuff. I felt like I met them for the first time and they were able to thrive and be who they really can be.
That's amazing. So did that start with exercises?
Yes. So a lot of it started out with just exercising, because nobody thinks about these muscles. When we talk about working out and our bodies and being in shape, we all think about everything shoulders down. Like, do we have nice abs? How are our arms? Are they saggy?
Biceps.
Like,
Yeah.
yes,
Yeah.
everybody's looking at all the wrong things, where a lot of health really starts up here at the top. If you're frequently congested, if you're breathing through your mouth a lot, if you get ear infections often, like, a lot of this stuff impacts the way you're able to breathe, sleep, digest, speech sometimes, your dental development. Like, that kind of stuff will put you in braces much faster if you were on a trajectory where maybe genetically you probably weren't predisposed to that. So
Mhm.
it's very multifactorial, but
Mhm.
yeah.
Mhm. I feel like I have a lot to learn because I have allergic rhinitis and I feel congested almost all the time. Plus, I think I mouth breathe as well. And then I've been told that sometimes I breathe really loudly, but it's not something I think about. I don't know any other way to breathe, but maybe I can learn a different or a better way to breathe with you today.
Absolutely. Nobody's ever thinking about it, but physiologically, breathing should be silent. Like, we shouldn't hear anybody breathing, but it happens a lot. And I think there's so many people on the planet, and sometimes we're in congested spaces like airports or public stations, like train stations, bus stations, and you just hear people breathing very often. And so we assume that it's just a common thing, but it
Mhm.
is something that, yes, we should all be looking out for, like open mouth breathing, audible breathing. These are red flags. It's not how we're intended to breathe.
Mhm. So when you see someone, can you instantly identify that, okay, this is incorrect, this is correct? Is it very quick for you?
Oh, yeah, almost always. Yeah.
Okay. Okay, and then how would you tell people to breathe then if they're not doing it correctly? What would you ask them to change?
So there's two aspects to breathing that I need people to be very highly attuned to. One is whether they're breathing through their nose or their mouth. There's a right way to breathe. So
Mm,
our nose is our primary mode of respiration, and that should be how all the air enters our body. It is going to warm and filter the air, and we're going to produce nitric oxide, which helps all of that oxygen like latch on to the bloodstream and get everything where it needs to go. But when we mouth breathe, when we breathe through the mouth, there's no mode. There's actually more of a drying mechanism. So there's no moisturization of that air. There's no nitric oxide production. There's no filtering of the air. And you can't fill your lungs completely when you breathe through your mouth. You're only filling about two-thirds of it. The lower third doesn't get filled with any mouth breathing. So you're lowering your amount of air that you're intaking, and you're getting a lesser, poorer quality of it. So that's the first thing I need us to all be aware of, is like, are you breathing through your mouth or your nose? And sometimes mouth breathing isn't what you would think of. I know that a lot of people think mouth breathing is like mouth absolutely all the way open, and it's
no.
not always. Sometimes it's that little part in the
Right.
lips that we consider, yeah, that we consider like a model. Most models, and if you look at some supermodels now, everybody's going to look at it a little different now after hearing this, but when you look
Yeah.
at some models and their lips are just slightly apart,
Mm.
you could be breathing through that little gap in the lips. And so we need to be just very attuned to that,
Mm.
but also that there is a proper posture for breathing. If you are breathing through your nose, you could be helping your nose or harming your nose depending on the oral posture. So, where's your tongue? And so, we
Mm.
can do a quick 1 minute test where I like to ask everybody to just put your feet flat on the ground, sit up as nice and tall as possible, and
Okay.
take a deep breath in through your nose and out through your nose to the best of your ability. And you're just going to take three more of those, and I'm just going to talk while you're doing so. I want you to just be really internally reflective. Where is your tongue in your mouth right now? And where are your teeth? Is your tongue high? Is it low? Is it in the middle? Is it kind of half up, half down, indiscernible? And are your teeth together or are they apart? So I'll tell you that the right position, as many of you might be getting a lot more clarity as to where everything is, the right position is that tongue lightly suctioned up, to the entirety of the roof of your mouth. That's your palate, from the front all the way to the back. So you should feel the front and the back parts of your tongue against the palate. This is going to keep it up and out of your upper respiratory tract because that tongue gets big and bulky, and women, especially when you're middle aged, we start to build on and pack fat first behind our tongue. And so that can block off a good bit of the room in where we need to breathe. But then it also stimulates the nasal floor because when the tongue is resting against the palate, the roof of the mouth, that palate is actually the same bone and the same floor of the nose area. So we want to stimulate nasal breathing and help our nose and be of assistance. I like the tongue to be considered like a respiratory organ because it really does assist in nasal breathing. And
Mhm.
so we want our tongue to be up. We want our teeth to be slightly apart because that tongue is actually giving us a lot of stability. If your teeth are together at rest, then that jaw posture is possibly influencing or preventing the tongue from resting totally properly. So it's a great way to just be aware of what's going on, is to just know, are we breathing through our mouth, through our nose? And then where is our tongue and our jaw in all of that?
So from what I've just heard, I think my tongue's in the right place, and I
Yeah.
think my my teeth are slightly apart, so that's fine. But what my question is how does breathing correctly actually prevent burnout, and what impact does that actually have on how we function on a day-to-day basis?
Oh, I love that question. Okay, so all of this goes into sleep. Now, I think we all know, or at least we've all heard, that there are stages to sleep. And so it starts like progressively mild, where, you'll get some light muscle relaxation and your blood pressure starts to drop and your heart rate goes a little lower. And everything progresses as you go forward into deeper stages of sleep. But these cycles of our sleep stages do not actually get to do full rounds if we have to reprioritize what we're doing. So at night, what happens is that we're lying down, we go to bed, and our muscles start to relax. Now, all these muscles that nobody thinks about, the muscles that support the upper respiratory tract, the back of the tongue, like everything that's going on, shoulders up, nobody thinks about those muscles, but those muscles are some of the first that start to relax in stages of sleep, and it gets progressively more so as they're starting to relax. We have to also consider that we're laying down. And so we have gravity that's imparting an additional amount of pressure on our body. And so those tissues that when you're upright and you're up all day, you might be breathing fine. You're like, oh, I don't feel anything during the daytime. Well, at night, that now makes them more susceptible to being more narrow and potential closure. So when you hear that, oh, maybe you snore at night, a lot of people think, oh, that's cute, or like, oh, that's just my husband. He snores like my dad, or whatever. I want us to rethink how we're imagining snoring. Snoring is actually the sound of air meeting resistance as it's trying to get through this narrow tube. And so when you think about that, if it was any other thing, like if it's food, because it's the same tube, if it's food and we're trying to eat and it won't go down and it's meeting resistance, that would be like a medical crisis. Everybody would be upset. What do you mean I can't eat? How is food not getting where it has to go? But nobody's alarmed at night when it's like, no, you can't breathe. But you know what is alarmed? Our body. Our body gets very alarmed, and then it's going to wake you up. It's going to wake you up, which will completely disrupt the whole cycle of the sleep sequence. And so you won't get into those deeper stages of restorative sleep because every time you go back to sleep, you don't just pick up where you left off. You go back into stage one, stage two, stage three sleep. And if you get aroused during stage three before you hit REM, you start back stage one, stage two. If you get aroused and woken up before you get to stage three, it goes back stage one. And if you never get into those deeper restorative cycles, you don't get all of the abilities that we need to function cognitively during the day. So instead of being able to actually rest and restore, so that the next day you can be on the top of your game, you can be as productive as possible, you can be able to concentrate and to focus, you're actually putting yourself into modes of, almost fight or flight, where our autonomic nervous system is now a little bit more on edge because we spent the whole night really fighting to stay alive. And then if we keep that going night after night after night, it just makes us a little bit more inefficient each
Mm-hmm.
day.
Mm-hmm. So, given everything we've discussed about sleeping, do you think this is very closely related to sleep apnea?
Oh, sure, absolutely. I think it's sleep disordered breathing is what they would term it, and it's really an umbrella. So that umbrella encompasses obstructive sleep apnea. It encompasses primary snoring. It encompasses upper airway resistance syndrome. There's a bunch of things that kind of fall under it, but the sleep breathing correlation is very much connected to sleep apnea as well.
Hmm. And we see people snoring so often, it's so common, but people don't seem to be worried about things like that. It's just, oh, normal, they're snoring, they're snoring. But then, how do we sort of change that reaction to snoring, because it's not perceived as a health issue, it's perceived as people just sleeping loudly. It's not normal.
Yeah.
Change that perception.
I think it's more about us starting to really reframe what we think about it. Like if I hear my husband snoring at night, I'll tell him like, "Oh man, you were breathing very poorly last night." So instead
Hmm.
of making it like a cutesy, like, "Oh, you were snoring so loud," it's like, "Oh, you were breathing very poorly." I think if we start kind of looking at it differently, it might set off the alarm bells just a little differently. And so maybe a shift in the public perception of snoring so that it's not just something that is common and it just occurs and like, oh well, it's something that is a little bit more alarming.
And do you think there's a correlation between how tired you are and how loudly you breathe at night? So if you're more tired, do you snore more loudly? Because I've seen that with people.
Oh yeah. And people will tell you that too, that that's something that they know that they might not snore unless they are incredibly sleep deprived. But how
Yeah.
did they get to that point of sleep deprivation? I think that's a bigger question, right? And a lot of people seem to think that when you sleep, you're able to sleep and you can catch up on it. So let's say during the week when you're working, you're not sleeping as efficiently. You're like, oh, I'll just catch up on some sleep on the weekend. That's not the way our bodies work. And so
Mm,
it adds, it's really only compounding over time. So when you get to that really, really tired phase, or when you get to that maybe Friday and you feel like you're really burnt out from the entire week of working and not sleeping efficiently, it doesn't make the sleep better to now be snoring and then wake up late on the Saturday. It's just another night of sleep deprivation.
mm. I've never thought of it like that. And And what tips would you give people to sort of have a healthy sleep or to breathe correctly just when they're, say you're tired, you can't help it. You've had a really rough week, out of your control. You have to work long hours, out of your control. Maybe your weight isn't in the ideal range, lifestyle,
Mhm.
out of control. How do you sort of tell them to still manage to sleep and have good quality sleep so that they don't burn out?
So one of my things is to just be very, very aware of the importance of the nasal breathing. And so with that, I always say to incorporate a nasal hygiene routine of some sort. I
Okay.
think people don't think enough about how we can optimize it, and it's really as simple as you clean every other part of your body. We brush our teeth, we shower, we so forth. Like clean your nose as well. Use a saline spray or saline rinse, or you can use saline irrigation, but clean out your nasal passages and then use something to help keep them open. That is your best sleep hygiene tip. Okay. Nothing that you spend hundreds of dollars on is going to save you more than like a dollar, or let's say less than $3 saline spray. So being able to clean out your nasal passages and then perhaps use something to help keep it open, like a nasal strip externally or a nasal dilator internally. is really a great way to help to optimize your breathing. That way you can sleep better and you're more likely to get through more of your sleep stages. I would also say it's really important to just be aware of how you're breathing during the day. Your primary mode of respiration during the day is probably going to be how you're breathing at night. So if you notice that you're doing a lot of mouth breathing during the day, be very conscious. Take time to consciously reflect on how you're breathing and to do little things to shift and alter it. Some people like to immediately jump to mouth taping. I think that, there's a reason why some people mouth breathe, and it's all right. You might have something going on physiologically that you haven't yet discovered that might need to be addressed. Enlarged turbinates or deviated septum, or you might have sinusitis. You could have something going on that's causing you to mouth breathe. So I would
Mhm.
never jump straight to mouth taping because your body still might need to breathe. And
Yeah.
so I don't know if covering it right away as your first option is the best. I would say optimize and clean out the nose as the very best way to start to improve your sleep hygiene.
Mhm. And say when you have your clients and you give them these tips about how to say exercise the correct muscles and say clean and be aware of their breathing, what real life changes can you actually see in them?
Oh, so many. So when we get good restorative sleep, we're able to wake up in the morning almost automatically on our own without assistance and lessen the dependence on something to keep you awake. So a lot
Yeah.
of times we have that dependence on caffeine or something to help get us going in the morning. Everybody needs a cup of coffee or a cup of tea or something to just kind of alert them, but you could really, so simply as being able to improve your sleep, be able to wake up feeling refreshed already and ready to go. So that I think is like the biggest change, is that you wake up feeling really, really good instead of groggy and kind of bogged down. The other thing is that you'll notice that your focus, your like alertness, is very much improved. There's been so many studies around sleep, and while there's still so much for us to learn, what we do know for certain is that without a good night of sleep, your memory is going to be impaired. And as we get older, I know I'm just as susceptible as everybody else as we get older to like forgetting things. When you walk into a room and you're like, what did I come in here for? And you're thinking about it. You could have more of those instances, or you could have less of those things. You could be working on your memory and your brain health by improving your sleep. So you can be more alert, you can be more refreshed, your memory recall could be better. I think it's really, really, really important that we focus on our autonomic nervous system and the health too there, because sometimes that anxiety that goes down significantly once we're sleeping better too. So breathing and sleep, I think, is incredibly important for a lot of our cognitive health, our autonomic nervous system function, and just waking up feeling really, really good.
Okay, so I want to know, when you were writing your book, is there anything very interesting that you learned about, say, breathing or sleeping that you were shocked to know? Any statistics?
Oof. I think that the biggest one is that 80% of some of these sleep breathing disorders do not get diagnosed. Like, people are not going and being checked for sleep disorders. So we have a large prevalence of snoring, which is a primary indicator that you have an issue with your breathing at night and could lead to upper airway resistance syndrome, could lead to sleep apnea, and nobody's really getting checked for it. So I think that was really alarming. Definitely a big, big one was that the World Health Organization had declared sleep deprivation a global epidemic in 2019. So before we even had like a pandemic, we've had the global epidemic of sleep deprivation. So it's not just like a first world problem. Like 70% of the global population is struggling with sleep. So these are some really big numbers that I think were shocking and alarming to me.
My next question is that, so doing the nasal rinse, which I think adding another step to your self-care routine for a lot of people is is tedious at this point because many people are doing a 10-step skincare routine, hair care, the brushing, the flossing, everything, dermaplaning, etc., etc. So then spraying the saline into your nose along with all of that, people might not want to put in that extra effort if they don't think it's absolutely necessary. So if people think that okay, I can just get a CPAP and give myself oxygen through that the whole night, maybe that'll mean I have great sleep and I don't need to do any exercises, I don't need to go to a myofunctional therapist. What's your take on that aspect?
Yeah, I think that it's underrated the value that breathing has on so many other aspects of our life. So even just like allergic dermatitis or eczema, so some of our skin health, if you're doing a 10-step beauty routine and you're not breathing adequately, you're already like not providing enough oxygen into your skin and reducing the quality of your skin. So your 10-step routine and like the saline's not a part of it, it's really it's counterproductive. It's like not drinking enough water but wanting your skin to be good. You have to put all the things together, right?
Guilty, guilty.
Yeah, we got to put all the things together. And so I think that it really comes along with it. What people really fail to have as like a real recognition is that we could go for days without water, we could go for weeks without food, but I don't know any human alive who can go for more than minutes without air. We all need to breathe. And so if we're optimizing the way that we're breathing, it can only be beneficial to our organ function, to our cognitive function, to our skin health, to our self care. It can only be beneficial. So it's incredibly important because breathing is the most important thing that we do, even more so than working on your diet. So if it's like, oh, I have to choose between my skincare or my diet plan and breathing, then you always choose breathing. Always.
Mhm. It's more sometimes that it's so passive that we don't even have to think about it, so we don't bother putting in the effort for it. Because I know I'm going to breathe anyway, except when I don't, and then either I'm choking or snoring or I don't know, something happens, and then suddenly I'm thinking, okay, something's really wrong here. But I think we tend to wait till there's a problem to actually focus on these sort of issues because people just pass it off as, oh, they just snore. And
Yeah, we completely take it for granted because it
yeah.
is an automatic function, but it is something that you can also take conscious control over. And so, because it's so important, I think it's important to prioritize it because it can only help with everything else. You know, when you sleep better, even just I mentioned before, like the whole diet thing, but even when you sleep better, that helps you with weight maintenance. If you're sleeping better, it's going to help you with just overall everything. Your immune system will run better. You'll have better cognitive function. Like there's no detriment to being able to breathe and sleep better.
Mhm. And what's your take on using, say, a guard to stop your tongue rolling back or sleeping in a certain position? Because some people like to do those sort of things.
I think those are important kind of tricks, I think, to have two up your sleeves, important little things to be able to manipulate in a different way. I think the best long term thing is to work on it in totality. So if we work on the muscles that are supporting it, it'll give us our best outcome in the long term. You can
Mhm.
wear a CPAP. You can try to alter your sleeping so that you're just a little bit more uncomfortable by sleeping in a brand new position that you force yourself into. And then as soon as you're subconscious, your body might roll into a different position that you
Mm.
are actually comfortable in. You can alter your position. You can use devices, but that's okay when you're starting out and you're doing all of this stuff and you're doing it for a couple of weeks, a couple of months, maybe a year. But once you get into like 10, 15, 20, the totality of your life needing to have a CPAP or needing to sleep in one special position or needing to have an oral appliance, and we're talking about 20, 30, 40, 50
Mhm.
years that you have left to live, it becomes a little more daunting when it's something that you could, do naturally. So I think that it's great in the short term Not everybody can jump into doing things like myofunctional therapy where we do exercises and retrain and we really work on the musculature. And so you need a little something. And so you'll do your saline, you'll do your, positional sleep hygiene, you'll do all the other little tips. And please do continue to use your CPAPs and your oral appliances if you need those. But at some point, when it all becomes quite tiresome, or you want to travel more, or you want to start dating and be in new relationships, I don't know, and you're ready to kind of move on from that stuff, I think the best thing is to really work on our natural ability to self sustain the patency of our upper respiratory tract.
Agreed, agreed. And have you ever done a sleep study?
I have not done a sleep study. Myself and my husband are the only people in the house who have not done sleep studies. We have
Okay.
4 children. And, like, everybody's done sleep studies, and we've seen like all the little nodules and things on the kids and whatever. I think that just happens because as parents, we always put ourselves on the back burner. So after dealing with one child and then dealing with another and dealing with another, dealing with another, and then I work and like deal with all of these other people who are doing sleep studies, I just never got around to me. But no.
Mhm. And if you did one, do you think you'd be fine on it? Hopefully.
I'm going to say hopefully. I
Yeah.
do take really good care with my sleep hygiene, and I am very like aware, and I do put forth effort into sleeping well. I make sure that I clean my nose every day. I definitely use my nasal dilator at night. Like, I am on top of things. So I'd like to say I would do well.
Mm-hmm. And if it's okay, could you show us maybe one simple exercise that we could try and incorporate for better breathing?
Yeah. Can I tell you that sometimes it's super, super simple? Like, nobody thinks about it, and I'm grabbing some water just so that I can show you. But gargling is like the easiest thing that you could do that really helps to work some of these muscles. Or if you don't have water available, you can always hum and extend the hum, because you're going to vibrate and really exercise some of these pharyngeal muscles, which really do support that upper respiratory tract. But if you take a little sip of water, and I always say water because when people think of gargling, they would think of like mouthwash or just like a salt water rinse. Just take a little bit of water. So, a small sip of water, a deep nasal inhale, you're going to tilt your chin up and you're just going to vibrate the water. And so it'll look a little something like this. And why I say that you don't use mouthwash is because it contains SLS, sodium lauryl sulfate, which will bubble. And so it'll start to bubble out and you won't be able to maintain as long. But trying to maintain 20 to 30 seconds of gargling 2 to 3 times a day, it's the greatest little workout. It's like a short little tip and exercise trick that I think a lot of people don't even realize that they have at their disposal just anytime that there's water around.
Okay. So before I sleep tonight, I'm gargling and I'm doing a nasal rinse. That's for
Yeah.
sure. Yes. And hopefully when I speak to you the next time, I am going to mouth breathe a little bit less.
Hooray! See, victory.
Victory. Is there anything else you'd like to share with our audience about your book or about yourself?
So the book is available on Amazon, but one thing I would love to leave everybody with is to advocate for yourself. There's a lot of times where I felt like I didn't like the answers I was getting about some of the things going on with my kids, and or sometimes where I feel like I don't get the right answers for myself when I go and I speak to some of my primary physicians. And I think that it's important that you know that not all physicians are the same. There are lots who will take time to sit and to listen with you and to dive deeper into what some of your concerns are. And there's others who are just a bit more strict. And so you have to just advocate for yourself and just push to make sure that you're speaking to the right people who will get you to the right providers or get you the right testing to ensure that, your concerns are being met. So advocate for yourself. That is my biggest mission. But the book is available on Amazon. It's accomplished: How to Sleep Better, Eliminate Burnout, and Execute Goals. It talks just slightly more in depth about a lot of these topics we talked about today, and a little deeper into myofunctional therapy. And it has just absolutely everything you can possibly need to really understand how to self help your way into better sleep.
Mhm. That was incredible. Thank you so much, Karis.
No problem. Thank you for having me. This is fun.
Thank you. I've learned so much today.
Thanks. I'm so happy.
All right. Thanks for listening to the Peppy podcast, and I'll see you next time. Bye.